So my name is Sarah. I have come to see Dr. Clark because of various issues. I have been diagnosed with hypothyroidism, but feeling as if taking levothyroxine was not really helping in any way, maybe other than increased energy levels, but still having trouble losing weight, most definitely, feeling sluggish a little now and then. After coming to see you, we have gone through some blood work, and
what we find out?
We found out that I had
Hashimoto's,
right? Because of
your antibodies.
Yes, thank you
Yeah.
for the great terms.
Yeah.
And so that's been helpful, as well as the other blood work and the saliva tests to determine hormone levels to get me on a supplement regimen,
right,
which has significantly improved. I had problems with constipation, irregularity, and I am now going to the bathroom every day.
Yeah. A lot of people take that for granted, but that's a big deal. You can't feel good if you're, you can't feel good if you're not regular. It's just, there's no way.
Right. I feel like being regular also helps with weight loss
Absolutely.
issues. I'm not gaining weight as much as I previously had, and I'm able to lose weight when I obviously make an effort.
Right.
I just generally feel better.
Right. So you were talking about, you noticed that you could, what with your clothes sizing?
Although I haven't necessarily lost weight, I went to the mall the other day and was trying on clothes, and I was fitting into clothes comfortably that were 1 to 2 sizes smaller than I had normally been wearing.
But at the same weight.
At the same weight.
So we determined what that really means is you had to have lost fat and put on muscle because you do exercise.
I exercise.
You do
5 to 6
kettlebells
days
and some
a week.
yeah. So that's most likely what happened with that. So that's a good thing. I'm trying to think of what else had you told me. Oh, you had some like memory stuff or some brain fog stuff.
I did. Right? I had noticed for the past couple months prior to seeing you that it was like my mind was aging. I would forget things, and I had always sort of prided myself on my ability to memorize things or remember things without making a list, and that was getting very foggy. That's no longer foggy. I'm back to me.
Yeah, very cool, right?
Yeah.
And your husband's happy, right?
He's very thrilled.
Yeah.
He's like my biggest cheerleader. He asks me every day how I'm feeling and how's it coming and is this working. And
well, it's very important to have a good support system, and it makes this one heck of a lot easier. So let's see, you've had those kind of improvements just over a couple months, right?
Yes.
It wasn't like a year. It was like
it was like May or something that I came to see you.
Within about 30 to 45 days, you were noticing appreciable stuff, and this is July, so you're doing good.
Right.
Awesome. Well, maybe we'll do a follow-up soon, but if you had something to say to someone who's been diagnosed hypothyroid but still does not feel good, even though they're taking medication, do you have any advice for them?
You know your body more than anything else. Better than most doctors. Come see Dr. Clark, if anything.
Okay.
But definitely keep asking questions and keep finding out because something's going on.
Cool. Excellent. Thank you, Sarah.
Sure.